you clicked on this video, you are probably questioning your relationship with the pill. Are you thinking of starting the pill or getting off the pill? Or you are probably wondering if some of the side effects listed on the package, such as stroke, are true. Either way, I've got your back. In this video, I explain how the pill really affects your body, plus what are the risks your doctor is not telling you about. I'm not anti-pill or anti-medication or anti-modern medicine or anti-anything really. I am for informed consent, which means doctors giving you all the information you need to consent to taking birth control. The pill has certainly benefited women tremendously, so this video is not here to judge nor condemn, it's just here to inform. Like so many girls, I've been told that the pill is a safe contraceptive method with no long-term damage. Lucky for me, I've only taken it for 2 months before doing my own research and discovering a pile of side effects that might in some cases be irreversible. But before getting to this scary part, let's first understand how does the pill work. Each month, an egg is released from the ovary. This process is called ovulation. At the same time, the lining of the uterus thickens to prepare for pregnancy. If fertilization does not happen, the lining of the uterus is shed in menstrual bleeding and the cycle starts over. These processes are controlled by hormones. The main ones, we have the follicle-stimulating hormone, FSH, and the luteinizing hormone, LH. FSH stimulates the immature follicle to grow and produce a mature egg, and LH is responsible for the release of the egg from the ovary. Then we have the hormones secreted by the ovary, which are estrogen and progesterone. After ovulation, estrogen and progesterone are at high levels in the second half of the cycle, preventing the ovaries from releasing more eggs. If fertilization occurs, these two hormones remain at high levels throughout pregnancy, which means a continuous suppression of ovulation. However, in the absence of pregnancy, their levels fall, causing menstrual bleeding. The most common type of contraceptive pills are combination pills. They contain estrogen and progestin, which is a synthesized form of progesterone. By taking these pills for 28 days, your body stays in a hormonal state of post-ovulation, tricking your ovaries into thinking that ovulation already happened, so no egg is matured or released, almost like you are pregnant. These pills should be taken every day. For 3 weeks, a woman takes combination pills followed by 1 week of placebo pills that don't contain any hormones. During this week, progesterone and estrogen levels fall, triggering what we call withdrawal bleeding, aka fake period. This bleeding is not required, it's just a reassurance for women that fertilization did not happen. Until now, everything sounds simple and good, a genius method, just take 1 pill every day and you're safe that you're not going to get pregnant. However, it's not always that simple. So what are the risks and side effects you might experience if you're taking the pill every day? You have probably heard that the pill can cause you to feel moody. And like so many women, you've been told that this is just in your head. Actually, a recent study in the Journal of the American Medical Association of over 1 million women showed that women who took the contraceptive pill were more likely to be prescribed an antidepressant. So it's a little bit more than just being moody, plus these side effects are listed right on the packaging. Another research has shown that women who use the contraceptive pill has decreased sensitivity to oxytocin, which can impact their ability to bond with their baby or their partner. This can make sense since we already know that the natural changes in hormones can affect our mood, our behavior, and social bonding. Another recent study has discovered that young women who use hormonal contraceptions have 3 times the risk of committing suicide than those who never use this type of birth control. According to this study, the risks are the highest during the first 2 months before reaching a plateau after a year. Another shocking result of this study is that teenagers have double the risk of suicide after 1 year on the pill and are at 30% higher risk after 7 years on hormonal birth control. So no, the changes you are experiencing aren't just in your head, they are real. I know these research are not perfect, they don't prove direct causation because many variables can interfere and more studies are required in this area, but they are enough to make us ask questions and reconsider how easily we prescribe hormonal contraception, especially for reasons other than birth control. Unfortunately, the pill is crashing your libido, which is counterintuitive because why take birth control if you're not going to have sex? Many studies have demonstrated how the pill interferes with women's sexual health and it has to do with testosterone production. In fact, the pill results in an increase of a hormone called sex hormone binding globulin that protects you from all the excess estrogen the pill delivers. But this hormone also binds testosterone, which is already low due to the pill shutting down production in the ovaries. So the result is no libido. One study of more than 1,000 female medical students discovered that women who were using the pill were 32% more likely to experience female sexual dysfunction than those who used non-hormonal methods of birth control or no birth control at all. The common symptoms women report include reduced arousal, difficulty achieving orgasm, pain with sex, painful orgasms, and overall lack of sexual enjoyment. You are probably wondering what my gut health has to do with my hormones. Well, your gut health has everything to do with your hormones. It's called the second brain for a reason, and it might be the very reason you're experiencing problems like acne, fatigue, cramps, or weight gain. Your gut is responsible for absorbing the nutrients from the food you eat, which in turn will make the hormones that you need. Plus, it also eliminates the one that you don't and helps you detoxify. When you're on the pill, your gut functioning is disrupted, which might explain many of the side effects you're experiencing, such as gas, bloating, or constipation. Birth control pills disrupt your microbiome. Microbiome is the healthy bacteria in your gut. It provides an environment for harmful bacteria and yeast to grow. The consequences of this can go from mild side effects such as gas or bloating to harsh side effects such as food sensitivities, the irritable bowel syndrome, depression, acne, or eczema. Some studies have also shown that the pill can destroy your gut integrity, causing harsh inflammation that increases the risk of autoimmune disease of the gut, such as intestinal hyperpermeability, aka leaky gut syndrome. Which brings me to my next point. An autoimmune disease is a state of confusion where your body destroys its own tissue. So instead of attacking bacteria, viruses, or parasites, your immune system starts attacking your own body. Autoimmune diseases are rising nowadays, especially among women. Statistics suggest that women are 10 times more likely than men to have them, and 1 in every 5 people have an autoimmune disease. According to Dr. Eliseo Fasano, a leading researcher in the field of autoimmunity, 3 ingredients are needed to produce an autoimmune disease: a leaky gut, genetics, and a stressful event like infection or exposure to environmental toxins. And I've already said previously that the pill can increase your chance of getting a leaky gut, which means it increases your chance of having an autoimmune disease. Furthermore, research has shown that too much estrogen enhances the inflammatory process of the immune system, which means it could increase the attack of your tissues if you already have an autoimmune disease. Research has shown that the longer the body is exposed to synthetic estrogen, like the one in the pill, the higher the risk of developing estrogen-related cancers such as breast, cervical, liver, and brain cancer. A recent study published in the New England Journal of Medicine followed 1.8 million women aged 15 to 49, found that women who used hormonal contraceptives have a 20% higher risk of breast cancer than women who used non-hormonal contraception. More long-term studies are needed, of course, but early evidence suggests that the risk does not disappear once you stop the pill. Instead, it's a long-term elevated risk. So if you have a history of breast cancer in your family, you might want to consider other types of contraception. Increasing your blood pressure is a common side effect to the pill. It is listed as a side effect right on the packaging, with the risk increasing if you are older than 35, overweight, or a smoker. Over a long period of time, high blood pressure can cause damage to your kidneys, your eyes, and your brain. It's also a risk factor for a type of stroke called transient ischemic attack. So monitoring your blood pressure is very important if you are on the pill. The pill is also associated with insulin resistance, diabetes, blood clots, metabolic issues, and strokes. I cannot go into every side effect of the pill, otherwise this video will be too long. But I will link some material in the description box for you to make your own research. It is very important to examine this research and statistics in the context of your own personal and family history, so you can decide what is best for you. I believe in women's right to prevent pregnancies however they choose, but knowing the risk associated with the pill is very important so we are 100% informed and can make the best decision for our health and body. If you are going to choose a hormonal contraception, you need to be aware of all the risks that come with it, and ideally know the tools that can help you reverse some of these side effects. You are the one who knows your body best, so you are the only one who can decide whether the benefits outweigh the risks. Let me know if you'll be interested in another video about the tools to reverse these side effects if you decide to drop the pill, or if you have to keep taking it. Plus, what are the other safer alternatives to birth control? As always, guys, if you made it so far, thank you so much for watching. Hope this video was helpful. Please like and share, subscribe to my channel if you're new, and of course, question everything, do your own research, and follow your instincts. I'll see you very soon in the next one. Bye!